What if the secret to healing your body naturally has been around for thousands of years and you just haven't discovered it yet? Welcome to Holistic Hope, the vegan friendly podcast show that uncovers the secrets to health that you've been searching for. I'm your host, Amanda Cuda. Welcome to the Holistic Hope podcast show. Today, we're exploring the ancient art of acupuncture with my personal favorite practitioner, Dr. Feng Zhang. Welcome to the show.
Thank you for inviting, Amanda.
It's so good to see you. I've been seeing Dr. Feng for
You too.
over a year, I think. We just had a discussion in the last week or so to get you on the podcast show because I want more people to learn about the amazing work that you do and really to expose more people to how amazing acupuncture is in general.
Thank you.
So let's get into it with our first question. Dr. Feng, can you tell us about your educational and professional journey that has led you to transition? Because you started from Western medicine and how you transitioned to acupuncture and herbal medicine.
Sure. I graduated from the Hunan Medical University before I moved to United States to pursue my doctor degree of immunology at the Vanderbilt University Medical Center. I studied and worked there for over 10 years before I transited to Eastern medicine area. And during my time in Atlanta, I did my research at the Division of Rheumatology and Immunology with Dr. Tom Arney. I liked my job over there. My research actually contributed to 6 publications of General of Immunology and one publication of Natural Immunology as the first author. Yeah, the reason how did I transit from working at the Vanderbilt to become acupuncturist? Since first I'm interested in this medicine actually since I was young. I self-taught myself acupuncture and Chinese herbal medicine for many years before I went to formal education in acupuncture and herbal medicine in Phoenix Institute of Herbal Medicine and Acupuncture. It seems I have to earn a formal master degrees of acupuncture and master degrees of herbal medicine. So this education actually covers traditional Chinese medicine principles, acupuncture techniques, and the related subjects. And this program of herbal medicine and acupuncture supposedly needed about 5 to 6 years. However, since I was growing up in family with doctors practicing this medicine, and I self-taught myself for many years, I have a stronger background in this medicine. I passed many challenging tests of the school and finished in about 2.5 years. Then I passed the National Certification Commission for Acupuncture and Oriental Medicine, ACCOM they call, exams and meet specific professional requirements to get the license on both acupuncture and herbal medicine.
Wow, that's amazing. That is so great that you were able to shorten the gap and you've grown up with this as well.
Thank you.
What inspired you to seek a more integrative approach to healthcare? You had your doctorate. How did acupuncture become a part of that journey?
As I said, I came from a family of doctors practicing traditional Chinese medicine in China. My grandfather is a Chinese medicine doctor in China. My youngest brother also is a traditional Chinese medicine doctor in China. So, and also, most important, during I growing up, I have witnessed and beneficial to see this medicine on many patients in China. And also, I have personal reasons to make this transition as well. This involving close family members, including myself, help me to make these decisions. And my personal life was saved by this medicine. I was born in the poor countryside in the late 60s. I was infected by tetanus, and with a not sterilized knife was used to cut my umbilical cord after I was born. So I get tetanus infection. So this infection of tetanus toxicity was moved to my jaw, which caused I had a locked jaw. That makes me couldn't eat. Or this is a critical knife threatened condition. So, but luckily I was saved by our local famous Chinese medicine, Dr. Shu, who was very specialized to see the child. So Dr. Shu, after seeing me, prepared the powder of herbs to blow to my throat and waited for 50 minutes. I started to suck some bread milk. Totally 2 times visiting to save my life. This story, while growing up, my parents always told me about this. During my growing up, I always used herbal medicine and acupuncture to keep me healthy. And I know this is a 100% natural treatment. So that's
Wow. So from a young age, so they cut the umbilical
no,
cord
no,
with a
yeah,
unclean knife,
I mean knife,
and that
yes. That
gave
is
you
to test the infection.
tetanus.
So I was born, and just a few days I was in hospital. This is untreated by antibiotics. I'm lucky to meet a good doctors who specialize in this field. Only 2 visits with the herbs blowed to my throat saved my life.
Wow.
Now I'm 55 years
So they
old. It's
really
already, yeah.
blew the herbs into your mouth.
Yeah,
Wow.
into my throat.
Into your throat.
Yes, 15 minutes later, I started to suck the milk.
Wow.
Saved my life.
Isn't a quick result. Your mum must have been so
Yeah,
relieved at that time. I
yes.
can
So
imagine how.
that was always told this story about me when growing up. Yeah, yeah. I really appreciate Dr. Shu saved my life.
Yeah, I'm grateful for him too, because I'm so
Yeah,
grateful you're here doing the work you're doing. So,
thank you.
for those who are not familiar, they've probably heard of acupuncture, but they really don't know how it works and how that forms a part of the traditional Chinese perspective. So, can you give our viewers an overview on what is acupuncture?
Acupuncture is a component of traditional Chinese medicine. Another component is herbal medicine. These are like two tools to treat people. They are under the same principle for medicine. So acupuncture actually is people using very thin sterilized needles to insert the acupuncture points of the body to stimulate organs and correspondingly to your body's meridians. So I know meridian, people don't confusing what's meridian. Actually, meridian is a line in your body. This is like anatomy of your body. Connect to different acupuncture points corresponding to different organs of your body, which are a passageway through which energy flows through your body. So that works. Normally, we have 12 major meridians. Each organs they have their own meridians. Include another two meridians. One is in front rim meridian, another back is du meridian. And for this medicine, everything is about yin and yang. And yin yang is two sides of your body. Normally, yang is a side that faces the sunshine, like outside is yang meridians, and the inside that is covered by the sun, that is your yin meridians.
Okay, so we
Tell
have
you,
12 main meridians
yin meridians
plus the two.
plus two extra meridians. One is to the front, in the middle of your body. Another one is back of meridian. Actually, if you think about the Western medicine, that is belong to spine, spine points.
Spine
That
points.
meridian. Do actually is govern your whole body yang. Yin is meridian is actually your whole body yin. Yeah. That's I want to know a little bit difference between yin and yang. Normally, yang is the energy you cannot see, you cannot touch, but they exist. Yin is the material, that you can see, you can touch, you can measure.
Mhm.
So that's yeah. Every organs that have yin and yang two sides. Yeah.
Okay. And I know when I've gone in to see you for certain things and you've told me that's the yin or that's the young. I am always really fascinated when you tell me. It's so interesting. So, what is the unique benefits that acupuncture offers?
Acupuncture is emphasized personal care and based on individual's symptoms. So it treats the roots of the disease, not just your symptoms. And also it's a 100% natural treatment.
Yeah, it's just it's interesting that people ask if there is medication on the end of the needle because they've been so indoctrinated by Western medicine. We are always believed that you need a pharmaceutical to treat something. But when they do that, they're not really getting to the root cause. It's more that they're treating a symptom where acupuncture is so different and been around thousands of years, it's so different how they treat a body and actually treat well, we're gonna go into a bit about the energy in a moment, but it's so interesting that people still have this perspective that what you must dab your needle into a specific medication. One of the things that fascinates me the most about what you do, you go to a Western medical doctor and they're going to take blood tests and then they're going to get your symptoms and treat your symptoms. But with what you do is so completely different. But I just wanted to give so, when people thinking, oh, are you going to put needle in a medication? But just even the way you diagnose is different. Diagnosing is very different between Western and Chinese medicine. But then also, once you have been able to diagnose the patient, what happens with the treatment? So I kind of gave up on Western medicine because I felt like they were just treating a symptom. How is Chinese medicine different?
First, we'll not use chemicals, right? The acupuncture needles is 100% naturally and no any medication like I emphasize. And we after a diagnosis, we use different terminology to diagnosis. Like for example, we think about your body is we body like the heaven. We have a small heaven universe in our body. So with diagnosis, we will have damp, some heat, cold, or wind use this kind of terminology to diagnose people. Of course, we have science to tell you how to do this. Example, if people come in, your diagnosis is spleen deficiency caused dampness. So you need looking for the spleen meridians. But you also need to know this spleen meridians is not only your body have other organs. We use five elements to the patients generally. Five elements that match your five major organs of your body. Like spleen and stomach pair together. They're husband and wife. That they belong to that digestion system, and that actually in this medicine belong to earth. So that
Mm,
earth. So you need five elements. It's what generate earth. Actually, is fire. Fire, fire generate earth. Then, but the earth generate metal. This is five elements. You have to keep your body balanced. Actually,
mm.
simplify, you have used these five elements to keep body balance. You have to think about when you treat the earth, normally, the five elements to keep, you cannot overgrow everything. So you have to normally is wood override to the earth. And the wood is match the liver actually. So you need, when you treat the earth, you have to treat the liver. So this kind of things is play around. Actually, you have to analyze it.
Wow. So you're treating the five elements, and with that, you're not treating the symptoms. You're kind of getting to the root
You're
cause.
You're right. And then, for example, some people, like heart palpitations, right? So this can be heart, but also can be other things. Can be stomach. Seriously, for this
Mm,
reason, spleen can enter your heart. Also, liver meridians also can enter your heart. So you connect
mm.
everything together. You use the five elements, make sense, everything. So I
Yeah.
have to not only treat you one sign, I have to take your body as a whole picture to treat it.
Mhm. Yeah.
Yeah.
And I like that more because I've come to you at times for my foot recently. I hurt my foot on my recent travel, and then you hit a point, and I was like, "Oh, what's that?" And then you told me it
Ah,
was my gallbladder point.
yeah, yeah. That also, you remember gallbladder points, they have divergent points, divergent meridians of your gallbladder. So I was looking for the divergent meridians, whatever, to treat you. Yeah,
Yeah.
yeah.
Yeah, and I love that. So it's not just let's look at one problem, one symptom, treat that one thing. You're looking at a
Okay.
whole picture.
Yes, yes. We have to analyze it, looking for whole picture. Actually, when people come in, I will analyze it in my brain. Since now I'm familiar with, I'm a fast, yeah.
Yeah.
Mhm.
It's so great. So, what types of conditions or ailments do you find acupuncture particularly effective in treating?
Uh, in my office, actually, of course, people when think about acupuncture, they will think about the pain, right? That's different kind of pain, of course, that works very well. And for my office, actually, like hormone imbalance, fertility, infertility, skin problems, all very good results.
Mm.
And I have many skin issues patients, all very good results. So sometimes people ask me, what are your specialty? I do have some specialty, of course, but this is medicine took your body as integrative, has a whole picture. So I'm not only just to see the one field, I can analyze this. So that's make me more flexible to see other patients.
Yeah, I know when I have an answer of any kind, I'm always straight to you, knowing that you're going to give me the answer I've been searching for, which is I appreciate so much all the time that one session is always the same. Sometimes we're treating a series of things, but then I can come in one day and be like, this has happened this week, and then you'll be able to easily pivot and be like, okay, let's work on that today.
Yeah. Yes. Seems your
Yeah.
body is a whole picture. You're
Yeah.
a human being, right?
Yeah. It's not always the one thing going on for us. It can be multi layers and just, having that great communication with you to know what's going on. And you know me, even when I walk in, you kind of know if something's out of balance before I even open my mouth.
Yeah.
So, what factors can affect the effectiveness of acupuncture treatment?
Actually, if you think about acupuncture, like I told patients, you come to see me, I use needles to help you, and there's no any medication. Why you get results? Actually, this is acupuncture. Actually, we use these needles to open your blockage of your meridians and regulate your qi. Also, you can say energy and blood flowing of your body, so make you get well. But so some patients, if they have less of energy, this energy are orange qi. This need to be told by us. Not only say you're fatigued, no, that's difference. For example, actually, that results is not good. And recently, actually, I had a patient actually 2 weeks ago and came in. So they complain pain. Actually, the patients come in, he's 50s. He just came back from Europe. So he actually complains low back pain actually, but he lost weight 15 to 20 pounds very fast recently, and he's constantly low grade fever, pain, lots of things. I thought about it. Doctor also will thought about whether she has cancer. Second time they want to come, I call them. Do you have any bleeding in your urine? Do you have any anemia? Since by my eyes, I can see she come in. She's very black. She under
Mm.
face black in this color. This is our observation. Later, next Monday, the wife texts me. He's in the ICU. She has internal bleeding.
Oh, wow.
Friday, suppose they come to see me, I ask their hold. So I once also have one patient is a gallbladder cancer. This lady didn't go through chemotherapy at that time, still waiting for the doctor to see. But she has uncomfortable pain, nauseous in the middle of size of in the middle. So when you need her gallbladder, there is a very important point, gallbladder. So you can feel, you needle there, you can get you needle in the I need a deep insertion. You cannot gain and you cannot feel any energy there. You can
Mm.
looks like you just the needle on the cotton of the ball. So her daughter-in-law was a physical therapist before, so I asked her come in. I said, you can see this indeed. I insert this deep. Normally, people just a little bit they can feel like a very heavily reaction in that area, but no, he just feel you insert a lot, you cannot. You like very empty. You feel empty. So when I tell you this will not be good results. But
Oh,
not people fatigue, no. No, not fatigue. Normally, it's very serious condition. Yeah, this very sick people.
yeah. So, and then in that instance, more things need to be done.
Mhm. Okay. Yeah.
Yeah.
Mhm.
So, how has your acupuncture and herbal medicine practice grown over the years? You've just shared a couple of stories. Do you have any other stories from your experiences that you'd like to share?
The success for acupuncture and the herbal medicine practice is based on referring without any advertisement. Many of my patients refer their friends or family members to me. My office is a pretty busy, and patients want to get the results as soon as possible. Otherwise, nobody would like to spend their pocket money to ask you to poke them. So people come in for help, want to try natural healing or want to seek another medicine for getting well. This year, I have a pulmonary hypertension patients who I started to see this year at the beginning of June. Pulmonary hypertension is a different type of tension that normal people recognized. It is because of any issues of the lung causing the arteries of the lung to have high blood pressure. So our body needs to exchange the blood from lung and heart to get oxygen enriched blood. So the high blood pressure of the lung arteries can make the heart work harder than normal. This will damage the heart, leading to dilated and dysfunction of heart and causes symptoms such as shortness of breath and chest pain. There's no cure for pulmonary hypertension. Luckily, these patients and the treatment for acupuncture at my office is getting well. So compared to her Auckland results, the RVSP, that is right ventricular systolic pressure, which is a measurement to assess pulmonary hypertension, has decreased from 71 to 41, which is closer to normal range between 33 and 39. And
Oh,
also her dilated heart is getting big improvement, and her symptoms are also much better now. This actually, in fact, gave me a big shock since this is the first time I have seen pulmonary hypertension patients, and this patient was also shocked since she only tried acupuncture treatment. I think her doctors too. So I'm still seeing these patients once a week now.
oh wow. Isn't that fantastic?
Yeah, this is just a recent case. Yeah,
Yeah,
and
that's so amazing. I think you have a couple of more success stories that you wanted to share with us today as well about hyper and hypothyroidism.
oh yes, I have many hypo and hyperthyroidism patients in this office, and 99 I will say they all get the results. I also have some people they tried hormone therapy for hypo, but unfortunately they changed from hypo to hyper. And
Mm.
but now people come see here. They removed one patient removed half of medications. One patient totally removed all the medications. They all come back to normal of thyroid functions. Yeah, and also have some Hashimoto disease and Graves disease. That is autoimmune disease. Recently, I also have several of these patients now. They all get very good results. This was a surprise to me actually. I only use
Yeah.
acupuncture, even no herbal medicine.
I know, because I would always ask you, because you've been helping me with my Hashimoto's diagnosis, and with my last blood work, the doctor gave me 3 months to get it under control, or he was going to bully me into taking medication, and you and I have these discussions that I just refuse to be on medication, and after I worked with you consistently for 3 months and I went back to him, and he was blown away. He's my results were all going back to normal range. They weren't perfect, but they was a massive improvement. And he just said, "Continue with what you're doing, and I won't need to put you on medication." So I continues to see Dr. Fang all the time.
This will help you. And also, this also surprised me actually. Since I know Western medicine, I know hyper and hypo. But when patients come to see me, hypo normally is related to kidney yang deficiency. Hyper normally is kidney yin deficiency. Normally, of course, this
Mm.
they have some difference. Yeah.
Yeah, wow. And then when you just say the word kidney, that just freaks me out because my dad had 2 kidney transplants. So I'm
Mhm.
always wanting to make sure I have really good kidney health because I do not wanna end up what happened with him being on dialysis machines and just a rabbit hole of the Western medical system, the not good rabbit hole.
Yeah, but like I said, I say kidney here is not only kidney organ. They include
Mm,
adrenal glands, include part of thyroid function. So do not be
yeah.
so. Hmm.
And isn't that good just to, like, be reassured? So even though you say the word kidney, it's not something for me to freak out about. And so for people to just be like, "Take a deep breath, go see your acupuncturist, you'll be fine." So let's talk about someone going to acupuncture for the first time. How do you tailor treatments to the individual needs?
Oh, that's definitely a visit. I will say diagnosis treatment. Visit is very important. I need to know you. This is like you go to the hospital, you need to do exam, right? So this is we use our diagnosis system to check you. I will find your whole body. Now I can check your whole body. So then
Mhm.
I, based on your whole body condition, to tell the treatment program for the people.
That's awesome. For people who are a little bit worried about how needles feel, what would you tell them?
You know that you tried that. It's not like you injection, draw your blood. No, not like that. And it's a very thin needles. And normally you see when I do acupuncture in my office, I use my finger to feel the points. Normally points actually you can feel is a dent actually if you feel very carefully. And so people can handle it. It's not that pain, just zen.
Yeah. It is, I've been trying to get my husband to see you. He's really afraid of needles, and I keep trying to reassure him that it's not what you think. So maybe he might watch this podcast episode or maybe even just this section and hear you say that it's really not that bad.
Not that bad. Mm.
So can so I think we've already spoken about this already though. This was one of the questions I did have for you. Can acupuncture be used alongside convention Western medical treatments? And if so, how do you ensure a safe and effective combination?
Oh, that's definitely we can use together. So this is integrative, right? I like it. I like Western medicines has answer tag to diagnose diseases. So
Mm,
in my office, actually, patients will bring the lab results or exam results to show me before treatments, during treatments, and after treatments. This also can give me a clue to diagnose my patients and also give me upgrades of the results and also improve patients' beliefs of this acupuncture. And I have patients in this office for the cancer recovery patients. It's very good. Combine
mm,
puncture and Western medicine. I have patients like prostate cancer patients, breast cancer patients, colon cancer patients, and lung cancer patients. All very good results if you combine both medicine together. And
mm,
yeah, actually, I have a prostate cancer patient, 10 years, is already stage 4, late stage. And the chemotherapy, he went through a lot of pain. lots of pain. This definitely can help his pain go away. And later he told me his PSA, CEA results also get very good, you know.
Mm.
So
Wow.
definitely. And normally, sometimes if I give the herbs to patients, I will tell patients if you take a medication, you have to separate taking in 2 hours, not take together. Since this 2 to 3 hours can avoid the interaction.
Right. Yeah. So be mindful
Mm-hmm.
of contradictions. So, with every modality, with every practice, with every medicine, there are always misconceptions out there. So, what are the common misconceptions about acupuncture that you would like to address today?
The first is healing crisis. Healing crisis of acupuncture. That's a very few people may result in a healing crisis in the beginning. Seems your body, especially some people, if they're sick for a long time, they may have it. For example, some people after acupuncture they will feel, oh, I feel so energetic, but very few people they will feel uncomfortable. This normally is a healing crisis. Your body need a reset. Sometimes I ask them, you can Google search acupuncture healing crisis. So they will feel confidence about that if you see ask them of sick.
So, the healing crisis, that's more like you'll feel better before you feel worse.
Yeah,
Sorry, you'll feel
yeah,
worse before you feel
yeah,
better.
yeah,
Wrong way
yes,
around.
yes, that's true.
Yeah.
Especially skin issues patients. I always tell people
Mm,
in the beginning, you may have more skin issues come out in the beginning, maybe first 2 or 3 treatments, but later you will
mhm.
get it. Seems your body needs this out.
Yeah. I know I had that at the start of my alternative holistic healing journey. And I don't think it was acupuncture that where that happened, but I definitely know I went through a healing crisis because I was a mess. Like 12 years ago, if you would have saw me, Dr. Fang, back then, I would have been the worst patient. Really bad diet, really overweight, all the things going on with me. So I do understand and want to just, assure people as well that can happen, the healing crisis, but just know that keep going with it. Don't stop.
You're right. Sometimes some people come here, they will take some herbs, or after uses they will diarrhea. I say no, it's just good
Mm,
diarrhea. You need to detox your body. And also some people, I have some emotion people like anxiety patients come in,
mm,
depression patients come in. So during the treatment on the table they were crying. It's good. This is good crying. This is emotion release. And
mhm.
this after that they will feel good.
Yeah. Yeah. I've definitely had my fair share of emotional releases.
And also, some people may feel some reactions like heaviness, numbness in the area that's inserted the needles. But this is good reaction since we call this 得气 gain energy. And this discomfort actually will disappear after about 10 minutes. So sometimes I will tell patients, no, you will be good in 10 minutes. Yeah, after 10 minutes.
Yeah. Yeah, that's awesome. Is there anything else that we haven't covered about acupuncture that you think people should know about?
First, needles does not hurt. And it's not like injection. That's a lot of people scared for, and they just need to relax.
And I think you have some beautiful essential oils that you diffuse
I
in the
do.
reception area in your office to
I
relax
always
people
do
upon
that.
arriving.
Yes, that is actually that's what I want to talk about this,
And
integrative approach and the treatment. We did
oh, the integrative
that.
approach that you use. Yeah, let's go back to like what an integrative approach typically involves.
Yeah. So for me, I think an integrated approach that aims to mix the strengths of different practice to optimize patients' care and outcomes, instead of relying solely on one method. So we need to integrate it. Since
Mhm.
any therapy, any methods, they have their own good side, not good side. So typically, an integrative approach involves a holistic perspective, which considers the whole person, including physical, emotional, mental health, This idea is to treat not just the symptoms, but the root cause of the condition. And also combination of therapies. It integrates conventional medical treatments like medications and surgeries with complementary therapies such as we can chiropractor, herbs, and essential oils. These are all connected together. The goal is to enhance overall effectiveness and reduce side effects and improve quality of life, and also personalized care and collaborative care that practitioners from different fields work together to provide coordinated care. This is very important, not only just relying on solely one method. I think
Yeah.
it's important to integrate every therapist, every practice, they have their own advantage, disadvantage. It's good to combine all together. Take,
Yeah. I
take
love that.
advantage of all sides, yeah.
Yeah. How do you see the future of acupuncture and traditional Chinese medicine evolving, especially within the Western medical framework?
And future generations are more open to integrative approach. This can cause reducing cost and improve well-being.
Yeah. It's great that we can reduce medical cost. And I always like prevention better than the cure. So if something small starts, it can grow into something larger. But if
Mhm.
you work on that smaller thing first, you can prevent something worse from happening, like a heart attack or something
Mhm.
like that.
Yeah, yeah.
So tell us, Dr. Fang, what does your daily health and wellness routine look like? How do you incorporate the principles of acupuncture and holistic medicine into your own life?
I like hiking. Always go to hike, and especially during the good weather of Phoenix. I and Frank will always go to hike different trails every week. And sometimes we go to Colorado to hike at 14th during summertime, or Flagstaff. And Grand Canyon every year we will go down the Colorado River. And
Wow.
Payson, yeah, we do hike a lot. And generally in our family, we use acupuncture and herbal medicine when we feel uncomfortable, that
Mhm.
can maintain our health. So, and they include, of course, you have your exercise, you do natural treatment for yourself in the beginning of disease, in the beginning of a illness, you will get results faster.
That's awesome. I love that. I love that you do so much hiking.
Oh, yeah. Before I
That's
also
so
do some qigong. Actually, sometimes we do practice qigong at home, and during the night time, both of us do some meditations.
Oh, that's so cool. So, if there is one piece of advice or a health tip that you could offer to our listeners, what would it be?
Exercise is very important. Routine exercise and clean food is very important.
Exercise and clean food
Yes,
daily,
Da-
not just once a
daily,
week
not only once a week.
or once a month, every day. I think you would say 1 hour a day of exercise and eat clean food.
Yes.
That's awesome. Dr. Fang, thank you so much for coming on the show today. Where can our listeners learn more about your work and possibly schedule a consultation with you?
And please visit my website www.acchm.com.
Awesome. And I'll put the website link address in the show notes for people to click on and they can go directed to your website. Thank you so much for coming on the show today. It has been a pleasure to actually just sit down and talk to you and talk all things about acupuncture, which is part of the traditional Chinese medicine. To all of our listeners, thank you so much for being here today. If you liked the video, don't forget to hit the like and subscribe button. And of course, make sure you stay well and go get an acupuncture treatment. Thank you for joining us on the show today. If you like this episode, make sure to give it a thumbs up, subscribe to the channel, and hit the notification bell so you never miss an episode.